Bridge, new frontiers in type 1 diabetes.
We can divide type 1 diabetes into 3 stages. Traditionally, we've thought of type 1 diabetes as starting when you need insulin. But we don't need to start there. That's not the beginning. That's close to the later stages of diabetes. We call that stage 3. There are 2 earlier stages. Stage 1, when you have a lot of beta cells, so you can make a lot of insulin, you don't need insulin therapy, but we can detect the autoimmune process. We can detect autoantibodies in the circulation. And stage 2, when you have the autoantibodies, you have the autoimmune process, but you've lost quite a lot of beta cells, and now your blood sugars are not completely normal. Not at a level we would call diabetes, but dysglycemia or impaired glucose tolerance. We call that stage 2.
So clinical implications of a diagnosis of stage 1 or stage 2 type 1 diabetes are that there is an clearly increased risk to develop stage 3 disease that requires insulin treatment. So in stage 1 individuals who have at least 2 types of islet autoantibodies, the risk of clinical disease within 5 years is about 44%, within 10 years about 70%, and within 15 years about 80 to 90%, so approaching 100% in long-term follow-up. So these individuals with either stage 1 or stage 2 type 1 diabetes need monitoring of their glucose metabolism.
At the moment, the diagnosis of type 1 diabetes is always a big surprise to everybody, and it happens suddenly, and over 90% end up in hospital. Knowing that there's many stages before that can help us avoid that happening and make it possible that people don't need to come into hospital at all for that diagnosis. So if we pick it up early, we can monitor people through the stages and prepare them for the diagnosis months, if not years, before they need insulin. I think the stages of diabetes and the value of it is best shown by a colleague I was talking to recently. She's a pediatrician who specializes in diabetes, and she had a son with type 1 diabetes, and a husband actually with type 1 diabetes. And the son was diagnosed when he was sick and had to come into hospital. Then she had a daughter who was tested and picked up early, and that daughter was diagnosed out of hospital in a very calm setting. And ever since then, she said, I'm 100% in favor of screening. I do not want what happened to my son ever to happen to anyone else.
Bridge, new frontiers in type 1 diabetes.